Osteoarthritis, or OA, is the most common type of arthritis. It affects at least 13% of people living in Canada. That's about 1 in 8 people over the age of 15. Knees, hips, and hands are the joints most often affected. Our body cells that make up tissues are constantly renewing and repairing themselves. Though with OA, our body can't repair joint tissue fast enough. Increasing joint damage usually occurs gradually over a long period of time. OA also affects the joint linings, surrounding ligaments, and muscles. OA is a progressive disease of the whole joint that leads to breakdown of the joint cartilage and the underlying bone. When a joint develops osteoarthritis, the cartilage gradually roughens and becomes thin, so it doesn't work as well to provide a smooth gliding surface or act as a shock absorber. The bone tries to repair itself, resulting in bony spurs at the edge of the joint that can cause pain and limit movement. For example, with OA of the knee and hip, activities like trying to get your socks on can be more difficult and painful. Osteoarthritis can also cause the joint lining to become irritated and produce extra fluid, making your joint look bigger and feel warm, while causing pain as it puts pressure on the ligaments. The ligaments slowly thicken, making the joint stiffen. You may experience stiffness in the morning or after being in one position for too long. Pain and swelling can result in a decreased activity level, further adding to muscle weakness experienced with osteoarthritis. This can make your everyday activities more difficult. You may feel that you can't trust your joint or leg as it gives way due to weakness or pain. A number of factors can contribute to the development of OA, including older age, being female, being overweight or obese, joint injury, repetitive use of joints, muscle weakness, and inactivity. Some factors can be changed to reduce the risk of getting OA and slow its progression. Losing excess weight, strengthening muscles, and being more active have been shown to lessen arthritis pain and improve function. An increasing amount of research supports the effectiveness of activity and exercise as a self-management strategy for OA, as well as many other chronic diseases. Exercise and activity is the magic pill. Activity and exercise can help feed your joints. Cartilage has no blood supply and is mainly nourished by the synovial fluid in your joint. Loading and unloading of the cartilage that happens with weight-bearing activities and resistance exercises pumps the fluid in and out of the cartilage, removing waste material and providing nutrients, keeping it healthy. However, static weight-bearing, such as standing for prolonged periods of time without moving, can be detrimental and can make cartilage more vulnerable. Weight-bearing itself isn't enough. Activity is important. Activity and exercise can also relieve stiffness, improve strength and energy. Make your everyday activities easier to do with increased energy levels. Limit loss of muscle strength and bone mass with aging that is partly due to inactivity. Improve your balance, decreasing the risk of falls. Help you get a better sleep. Improve your ability to deal with mental health issues such as depression, anxiety, stress, and self-confidence. Help you manage your weight, reducing the load on your joints. Decrease the risk of developing a number of chronic conditions such as heart disease and stroke, lung disease, circulatory problems, type 2 diabetes, high blood pressure, osteoporosis, and the risk of certain cancers such as colon, breast, lung, and endometrial. Physical activity is any body movement produced by muscle that requires energy. Physical activity can include anything that gets you moving, like household chores, working, recreational activities, active transportation, sports, and exercise. Increasing your activity level can help you better manage your arthritis pain, aching and stiffness, as well as improve your ability to do and enjoy work, leisure activities, and household tasks. Exercise is a part of physical activity but is planned, structured, and repetitive with the aim of improving or maintaining physical fitness. Exercise has been shown to be an effective treatment to maintain your ability to do everyday activities and manage your osteoarthritic pain. People with arthritis benefit from both activity and exercise. Activity provides general health benefits. Exercise programs that target specific components of fitness, such as strength, fatigue, and decreased energy levels, can be improved with cardiovascular or aerobic exercise or activity. Muscle weakness, decreased balance, and your ability to do everyday activity can be improved with muscle strengthening exercises that target the core and lower extremity muscles. Poor movement patterns that put extra load on the joints, making movement more painful and difficult, can be improved with neuromuscular training exercises. Finally, stiffness and loss of joint movement may be helped with the flexibility or stretching exercises. Any activity is better than none. A recent study found that adults 49 years or older with lower extremity symptoms were able to maintain high functional levels with only 45 minutes a week of moderate to vigorous activity. This level is well below recommended standards for healthy adults, and while more is generally better, everyone can benefit from an increased activity level. Canada Fitness Activity Guidelines recommended at least 150 minutes of moderate to vigorous activity each week, or 30 minutes most days of the week. This may seem like a lot, but you can start low and go slow. You might only be able to add 30 minutes a week to start, but you can build up to longer and more frequent spurts of activity over time. Activity can be broken down into as little as 10-minute chunks to still provide health benefits. This can allow you to do a variety of activities if it makes it more interesting for you. It is also less daunting and easier to slip 10 minutes of activity into your daily schedule. For example, 90-minute walks on Saturday and 2 other 30-minute walks, 30 minutes of exercise Monday to Friday, including aquafit 1 day, cycling 3 days, and 1 walk. Monday to Friday, a brisk 10-minute walk in the morning, at lunch, and in the early evening. If 150 minutes of activity each week is not feasible starting point, you could try 15 minutes Nordic walking Sunday, 15 minutes Nordic walking Wednesday, and 30 minutes of aquafit on Friday. The FIT principle, F-I-T-T, stands for the frequency, intensity, time, and type of exercise recommended to increase physical fitness. The FIT principle can be used as a guide to achieve health benefits and improve physical fitness for physical activity and exercise. Let's start at the last letter of the FIT by describing the type of exercise that should be included in a program to improve physical fitness. Cardio exercise or activity works your heart and lungs, making you breathe a bit harder, and will improve your energy levels. Examples include walking, hiking, swimming, or biking. Strength exercise or activity uses your muscles to make an effort and improves your ability to remain mobile. Stronger muscles are better shock absorbers, can help stabilize your joint, and improve your balance, reducing the risk of falls. Examples of strength activities are heavier house or outdoor work. Strength exercises can include lifting a load, for example, weights, soup cans, also using resistance bands, or using your body as a weight. Neuromuscular exercise or activity focuses on attention to and awareness of your body position and how you move, improving your quality of movement, reducing the load on your joints, and allowing you to move with more ease. Examples of activities that involve neuromuscular strength are Tai Chi, yoga, and Pilates. There are also specific exercises that you could do. Flexibility exercises and activity maintains or increases your joint mobility and keeps your muscles supple. For example, yoga and specific muscle stretching exercises. For cardiovascular exercise, aim for most days of the week, or at least 5. Strength. To gain muscle strength 3 days per week on alternate days so that you have a rest day in between, and to maintain strength 2 days a week is sufficient. Neuromuscular exercise. Aim for 3 days a week, but make sure you practice using proper alignment in your everyday activities, such as getting out of a chair or doing stairs. Flexibility. If your joint does not have full range of motion, aim for daily stretching. For cardiovascular or cardio exercise and strength, start with a moderate level of effort. You may be more aware of your breath. With more vigorous activity, you will start to sweat and breathe a bit more heavily, but you should still be able to talk. Neuromuscular exercise. Focus on quality of movement, which will require a different type of effort. Flexibility. Only go to the point of a strong pull with a steady hold, no bouncing. For cardio activities, any activity is better than none. As little as 10 minutes can result in health benefits. This may be your first goal. Gradually increasing your time will make it more manageable. Canada Physical Activity Guidelines recommends at least 150 minutes of moderate to vigorous activity each week, or 30 minutes most days of the week. Strength and neuromuscular. If your muscles are weak, start low with 1 or 2 sets of 6 to 8 repetitions. Gradually build to 3 sets of 15 repetitions over time. Flexibility. Do each stretch up to 3 times and hold 45 seconds. Starting an exercise program and being more active can be hard. Let's discuss some of the common barriers and tips for starting. Regular activity and exercise will help strengthen the muscles around your joint, providing stability and helping your mobility. Physical activity actually feeds your joints. The cartilage in your joint depends on movement and loading, in other words, weight bearing, to soak up nutrients and take away waste. At first you may feel pain when you're active or exercising, but it doesn't mean you're damaging your joints. Inactivity can contribute to weight gain, which increases the load on your joints and is harmful to your health. Even if you've been told you have no cartilage left and you need a joint replacement, your pain and function can improve with activity and exercise, as well as make your recovery from surgery easier and faster. After joint replacement surgery, activity and exercise are required to improve pain and function. Ask yourself what activities you enjoy most. Do you prefer to be indoors or outdoors? Do you like to be on your own for quiet time, or do you prefer to be with a friend or group for support and socializing? Do you like classes for direction and motivation, or do you prefer to do your own thing? Make a plan, breaking down your activity or exercise goal into smaller attainable chunks will make it more manageable and easier to do. Use the SMART or SMART method as a guide to make goals for yourself. For example, S stands for specific. What is it you want to do? Measurable. How much activity or exercise do you want to do? For example, how long would you like to go time-wise, distance, or steps? Attainable. Does this plan fit into your life and health situation? Relevant. Do you like this exercise or activity? Time limited. When do you want to achieve your goal? Track your progress. You can keep a diary or use a step counter to see if you meet your goals. It may be as simple as seeing if you can accumulate at least one activity or exercise period per day. This can be a great motivator, helping you form a healthy habit, boost your confidence, and help you move forward with your plan. Step counters and activity trackers can also help you track your progress and motivate you. A family activity or an exercise buddy can help make the activity more social. Doing it together helps you motivate each other. Consider joining a community center or club that does an activity that you like. You'll be sure to meet other people. If you don't have a solid block of time to devote to physical activity, spread it out. A 10-minute chunk of activity will result in health benefits. Incorporate activity and exercise into the time you already use. If you watch TV, consider combining it with activity by getting on the treadmill or stationary bike or doing some stretching. You can do your strength exercise during commercial breaks. Add more activity into your daily tasks. Think of using stairs instead of the elevator or parking further away from your destination. Could you actively commute to work or partway there by walking or biking? You could walk or bike to do your errands. Book the time for physical activity in your agenda as you would a meeting or an appointment. It's a date for your health. Sometimes just moving can make you feel less tired. Over time, increasing your activity level will help you build your energy levels so you don't fatigue as easily. Consider what time of day you feel less tired. This may be an easier time to start a new habit. Have an indoor activity like mall walking or swimming at a community pool if it's too cold, wet, hot, or icy outdoors. You don't need to join a gym or use machines to be active or exercise. Physical activity and exercise can be inexpensive or free. Walking in the park or a mall is free. If you want to gain strength, you can use cans of food, bottles of water, or resistance bands instead of gym weights. To limit soreness, start low and go slow. If you've been away from any activity or exercise for even just a few weeks, let alone months or years, your fitness level decreases. Your body needs a bit of time to adapt to increased activity. Think of gradually increasing the amount of time you're active and also the effort you make while doing it. Pace your activity and include rest breaks. Trying to do too much too soon can lead to injury, aches, or discouragement. And those are the reasons why people often give up on sports, exercise programs, or even routine physical activities that are a part of your daily life. think of how you feel after your first snow shoveling or raking session of the season. Start with activities that you enjoy and that you can do more comfortably. Once you're comfortable, you may want to try a new activity. Joint and muscle discomfort from physical activity doesn't necessarily mean that you're harming yourself, and there can be a greater health risk by not being active. A qualified fitness instructor can show you correct positioning and how to modify activities. If an activity continues to make your symptoms worse, your healthcare professionals may be able to provide additional modifications or recommend other activities. In the exercises videos for hip and knee, as well as shoulder, we'll discuss some good exercises to get you started and ways you can modify activities to your level. For more information about arthritis, please visit arthritis.ca.